Welcome back again to Microbiotics Bio Talk. How is everybody doing? Hope you've been good. I've been good too, or I've been trying to be good. All of us are trying to be good. I think that's the cocoa of the matter. So let's take a little break from vaccine related talk, and let me quickly mention a program that I was recently introduced to. It's a common topic, but for in recent times I was actually should I call it, what language should I use? I was dunked into the program and it was really eye-opening. The topic, or should I call it the program, or the concept, is the concept of infection prevention and control. Infection prevention and control, IPC. And it's been a very interesting event, eye-opening program to me, because I realized suddenly that a lot of people are actually very steeped into the study. There's a research, practice going on this program, infection prevention and control, IPC, and it's gaining, or it has been gaining a lot of traction, and now it's about to really become established as a practice in Nigeria. Of course, we have a lot of people who have been practicing it, a lot of healthcare facility, a lot of healthcare institutions, and but now I just got to know about it. So from my perspective, it's it's just getting established. Okay, so what infection prevention and control is usually established in healthcare institutions, and they are more or less like policies and procedure that are implemented to control and kind of minimize the dissemination of infections or infectious diseases within hospitals and other healthcare settings. And the main purpose of this is to just reduce infection rates. And this might be between the patients and staff, between the patient and patients, between the patients and the caregiver, the family members, between the patients and it might be even from the other side, maybe from the staff to the patient. So and infection control has been established for a long while in the US for a while. And by the time that nosocomial infection, that's hospital-acquired infection, started gaining popularity, a lot of other countries started implementing it, and it's actually a very worthwhile policy, and the activity, the practice is actually very, very, because I've been very particular about nosocomial infection for a long time, and the fact that this practice has actually been entrenched is now becoming not only maybe that's why I didn't recognize it on time. It was a practice that was embedded within other practices in the past, but now it's becoming a kind of standalone program that now has a link into other practices. So no longer is it IPC within other practice, other procedure or policy, but IPC as a policy on its own. So this is actually very good. It's actually very good. And of course, we've already said that the primary purpose of infection program was to focus on the surveillance and the understanding of hospital-acquired infection, and it's actually very, very, it has proven very efficient in a lot of healthcare institutions. So infection control program, the main purpose, of course, to prevent and stop transmission of infection, and specific precautions are needed to prevent infection transmission depending on the microorganism that we are targeting. So let's look at the following precaution, the following examples of indication for transmission-based precaution. Of course, we have what we refer to as standard precaution, which is used for patient care. This one is actually very common. Standard precaution include hand hygiene, washing of hand, include the use of personal protective equipment, PPE. Of course, where you place the patient is also very important. It include the cleaning and disinfecting of patient care equipment, your catheter, your those things. Of course, it's also include the management of laundries, that are used in the healthcare settings. It includes safety injection practices. It includes the proper disposals of needles and of sharp objects. That's for standard precaution. Now we now have what we refer to as contact precaution, and this is used for patients with known or suspected infection that can be transmitted through contact. For these patients, standard precautions are also needed, plus limit transports and the movement of patients. Then we have to also include use of disposable patient care equipment, and thorough cleaning and disinfection strategies are also added. So patients with acute infections such as diarrhea, like with organism, with the causative organism, let's say Clostridium difficile, vesicular rash, respiratory tract infection with multi-drug resistant organism, and the likes that cannot be covered needed to be placed under contact precaution. This is different from standard precaution. Standard precaution is just general precaution, but contact precaution, the patient needs to be prevented from contacted and also to contact someone. So the other one is a droplet precaution. Droplet precaution has to do with is used for patients with known or suspected infection that can transmit by hair droplets. Of course, just like the word droplet infections. This, how do we transmit droplets? Mechanism of cough, you sneeze, or you talk. So in this case, it is vital to control the source by placing a mask on the patient. Simple. And you can also use a standard precaution and limit the movements and the transportation of the patient as well. So patients with respiratory tract infection in infants, young children, and with those with rashes, with fever and meningitis are usually placed under droplet precaution. And finally, airborne precaution. This one is different from droplet. Airborne precaution. This airborne precaution is used, or are used, because there is S at the back, it's a plural. Precautions are used for patients with known or suspected infection that can be transmitted by airborne routes. Now, these patients require to be in an airborne infection isolation room with all the previously mentioned precautions above, and with additional precaution. And the most important pathogens that need airborne precaution are usually tuberculosis, measles, chickenpox, and disseminated episodes, and recently COVID-19, of course. So patients with suspected vesicular rash, even measles, yes, cough, fever, and likes should be placed under airborne precaution. So these precautions are what we're going to only talk about this evening. In the next talk, we're going to be looking at the equipment, how we can the aspect of should I call them the core components of IPC. So we're going to be looking at IPC from the perspective of equipment, personnel, the techniques or treatments, the should I call it the guidelines, and so many other things. So we'll be breaking them down. This is just to introduce you to something that is coming. Of course, I like this. So, and I have a lot of, in fact, I just recently met an infection prevention and control specialist, in addition to the one I already had initially, making two real beautiful, brilliant people. And I'll hopefully be bringing them into this About Talk so that they can share their knowledge with us. So let me call it a day. Let me call it a night for those of you who are experiencing different time zone from our home. We'll be seeing next time, and till the next time we'll be seeing, make sure you stay safe. Yes. And starting from now, start implementing some personal policy about infection prevention and control into your daily life. It's very important. Nobody wants to get infected by hospital acquired microorganisms. Okay. So till next time, stay safe and have a lovely day or night ahead of you. Bye.